Having a children's hospital here in Southwest Michigan is huge. Kids are not just small adults. Babies are not just small children. They all have unique physiology. They have needs that are special to their development. Here in the NICU, or the Neonatal Intensive Care Unit, we see everything from the very premature all the way up through babies who are up to 30 days of age. The babies who are here range from being with us from a day or two, some of them for months and months. What patients receive here at Bronson, first of all, is care for the whole family. We have something called a breast milk bank, which is the only one in Michigan. Moms who don't need to give all of their milk to their babies, they give it to the breast milk bank. The human milk is handled better by premature babies. This is every bit as important as having antibiotics and IV fluid and all the rest of the medical stuff. But once it comes to the medicine itself, we can do an amazing amount here. Respiratory therapy, of course, our amazing nursing staff, occupational therapists, music therapists. It is a team, and it's a family too, as we all help each other take care of these families.
Kalamazoo is really quite unique throughout the country for this size of community to have a children's hospital and the numerous pediatric subspecialties that we have. Things like pediatric radiology and pediatric cardiology, pediatric gastroenterology, pediatric anesthesiology. The list goes on, and we're always trying to add more things that we know that the community needs.
Nurses on the Pediatric Unit are an integral part of the team. Each year on Pediatric Unit, we may see about 2,600 patients. We work very closely with physicians, child life, case management, social work, all to provide quality care for the patients.
As a pediatric surgeon, I find particularly fulfilling caring for children with complex diseases. It is a challenging part of our jobs. Care of children with cancer is very important to us, and we are blessed to have a pediatric hematology and oncology clinic.
I am one of the nearly dozen child life specialists that work within the Bronson healthcare system. Child life specialists are certified professionals that understand the fears and anxieties of hospitalization in children. Our job is to help teach them about why they're here, help explain any tests or procedures that they're going to have done, and we help support them through the procedure by being there with them. When a child first comes to the hospital, it can be very scary. They're seeing things they've never seen before. There could be all kinds of different sounds and noises and smells that they've never experienced before. So a very important job of children's hospitals and for child life specialists is making sure the environment is child-friendly. Children are often very fearful of medical equipment, such as a thermometer, blood pressure cuff, or different things that will be used in the room because they haven't seen it before. So we do medical play to help them teach them about those items so that they'll be more comfortable when the doctor or nurse comes in to do their assessments. We're very fortunate to have a full-time art therapist and a full-time music therapist on staff here at Bronson Children's Hospital. They're able to use different tools such as art and music to provide therapeutic interventions for patients and families.
The nurses on pediatric and pediatric intensive care have to work with the families. We know and understand that the families are the best source of information.
Well, Tabrice is a beautiful little girl inside and out, and she was 18 months old when I discovered her condition, which is asthma. She was really bad. It's very severe. I don't know what I would do if Bronson Children's Hospital wasn't here because they saved my daughter's life.
What makes Bronson Children's Hospital important is the fact that it is the only children's hospital in the region. The community relies upon it to take care of the kids, and it's just great to know that you'll get quality care when you're in Kalamazoo, right here at home.
So an important part of our care of children here at Bronson involves community participation, particularly through our donors who give to the Bronson Health Foundation to help support our activities. And we certainly hope that that kind of relationship and that kind of support from our community will continue and even grow.
The ripple effect of all of these, quote, extras, they're not extra. They impact literally the medical care of these babies, and it's made better by this community. So it is with a very grateful heart of our own that we get to say thank you and we need you. What a joy to be here.